Hi, I'm Wenlin, an occupational therapist from the National University Hospital. In this video, we are going to talk about the causes, symptoms, and treatment of trigger finger. Trigger finger or trigger thumb is a condition in which the finger or thumb catches or locks during movement. The finger may bend or straighten with a snap, like a trigger. For the rest of the video, I'm going to use finger to refer to both finger and thumb. The tendon sheath is like a layer of tissue which surrounds the tendons. The sheath is held in place by bands of tissues called pulleys. They hold the tendon close to the bone for its optimal functioning. The tendon glides through the pulley to bring about motion. The swelling of the tendon and the pulley affects the smooth gliding of the tendon that leads to pain or catching feeling during movement of the finger. During the early onset of trigger finger, the patient may feel aching sensations at the base of the affected finger. They may experience stiffness in the affected finger, particularly in the morning. As the condition progresses, the patient may feel pain or discomfort when trying to straighten or bend the affected finger. They can experience triggering of the affected finger, which is a popping or clicking sensation when they move it, but they can still actively straighten and bend it. In the moderate stage, the affected finger will lock or catch in a bent position and has to be unlocked using the other hand. It is likely that they will feel pain in the middle joint of the affected finger. And when it becomes severe, the affected finger may become locked in a bent position and cannot be straightened. Trigger finger can affect any digits, finger as well as the thumb, and more than one finger may be affected at a time. Triggering of the finger is usually more pronounced while firmly grasping an object or when straightening your finger. Trigger finger occurs when there is prolonged and increased tension at the pulley located at the base of the affected finger. This happens with tight gripping as the tension at the base of the finger intensifies with increased bending of the metacarpal or knuckle joint. Pinch activities where force is applied to the tip of the fingers also causes more stress at the base of the fingers. People whose work or hobbies require sustained or repetitive gripping, pinching, pressing of the fingers, or maintaining a firm grip of the hand with a hard surface for prolonged periods of time are at higher risk of developing trigger finger. Common activities that could cause trigger finger include wringing a wet cloth or laundry, opening of tight jars, carrying heavy bags, gripping of a tin pan, using power tools that vibrate, and prolonged typing. The condition is also more common in women, patients with rheumatoid arthritis, gout, or diabetes. Treatment of trigger finger varies depending on the severity. In the early stages, it can be self-managed and treated by modifying the way you perform certain activities, doing appropriate finger exercises, and wearing a splint to rest your affected finger. Activity modification can allow you to continue performing your daily tasks while allowing your affected finger to rest and heal. It is also important in preventing the development of trigger finger in your other fingers. While it is important to reduce the use of the affected finger, appropriate finger exercises would help to reduce pain and maintain its mobility and flexibility. Click on the video link in the description box below to learn these exercises. Your occupational therapist may also prescribe a splint for you. The splint helps to rest the tendons and block the affected finger from repetitive movements. Wear the splint as much as possible throughout the day and at night. Take it off during your shower and when you're doing the prescribed home exercises. Do not wash the splint with hot water or place it near hot objects. The symptoms should improve or resolve within 6 to 8 weeks. If it does not, please seek advice from your therapist or doctor. Another treatment option would be a steroid injection to reduce the inflammation and allow the tendon to glide freely again. The reoccurrence rate is 20 to 40%. If it reoccurs, you may opt to have a second injection. You can only get at most 2 injections in each finger. If steroid injection or conservative treatment is not working, your doctor will recommend a trigger finger release surgery, which involves cutting through the affected section of the tendon pulley so that the tendon can glide freely again. To find out more about our treatment of trigger finger, do talk to your healthcare provider or visit the NUH website in the description box below.